and Brad, the two most famous physical therapists on the internet.
Hi folks, I'm Bob Schrupp, physical therapist.
And I'm Brad Heineck, physical therapist.
And together we are the most famous physical therapists on the internet. Wake up, Brad. Come on, let's go.
In our opinion, of course, Bob. It was a rough night last night.
All right, today, Brad, we're going to talk, I don't want to hear about it. Today we're going to talk about 10 exercises and tips for knee pain relief by physical therapists.
You bet. And the knee pain we're talking about, it could vary from arthritic pain, they could have tendonitis. So this is going to cover quite a range.
A big variety of, it could be in the joint itself. So we don't know what's going on with your knee. Maybe you do. If you do know, then maybe you want to go to one of our videos with that specific problem. But if you're just having general knee pain, try some of these.
Right.
See if it helps.
And these are, if they make it feel good right away, you know it's right. If they irritate and give any sharp pain, I want you to stop them and forget about that
Good
exercise.
advice, Brad. Okay, the first one, Brad, is actually it could be for knee arthritis, or even if you're having a little bit of a meniscus problem, this sometimes works, especially if you can't bend the knee like you should.
Right.
It doesn't want to bend all the way.
Feels like maybe it locks up.
Yep. So what you're going to do, I'm going to actually do it on this leg here. And Brad, what I'm going to do, I'm going to go ahead and flip this up right away, Brad.
Yeah, look at that leg.
So what I'm going to do is I'm going to turn the lower leg inward.
Sure, rotate that tibia.
Yeah. So I'm grabbing on, the fibula here, which you don't know what that is probably, but I'm going to turn, and while I'm turning, I'm going to actually bend the knee.
There you go.
Okay, and you can do this 10 times. I'm turning the leg the entire time.
Okay,
I'm twisting it, I'm rotating it the whole time as I go forward and as I go back. As I go forward, and you try to go further and further, Brad.
Right.
Eventually you try to see if you can make it go further.
And you'll do this if you can do it and it feels better.
Right.
It's like each time you do it, it feels better each time and the pain is less.
Exactly. We don't want increased pain. And like you said, like Brad alluded to, the fact that the good sign is if it actually feels a little bit better after you're doing it for a while.
Yep.
I just had a nurse do this, and it worked out really well for her.
Oh, good.
Again, something was going on in her joint, and it just seemed like she got more and more motion and less pain.
Yep.
All right, the next one. This is for what we'd call a patellofemoral problem, underneath the kneecap itself.
Sure.
It's giving you trouble.
Yep.
And this is just a simple test you can do. Let's say you go up some stairs, Brad. Dump, 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 dump.
How's your head, Bob?
Yeah. And you come down again, but every time you go upstairs, the knee hurts.
Right.
All right. This is a simple test. I think you've done this one, right, Brad, or not?
Sure, I think so. And usually, oftentimes, would you say it hurts more going down the steps than up?
Quite often it does, and there's a biomechanical reason for that. But so we're wondering whether or not you have some pain underneath the kneecap. Now, that pain can be anywhere around the kneecap itself. It's kind of gives a weird sensation to people.
Yeah.
So what you're going to do, the simple test here, I already put some tape down. Yeah, you're going to want to be fairly close on this one, Lonnie. I might actually from this angle maybe. So I've already put some underlying tape on. What do they call that? Underlayment tape, or this tape will not irritate my skin. It's hypoallergenic. So what I'm trying to do here, Brad, is I'm trying to take the kneecap and I'm moving it towards the middle.
Besides, when you put the tape on, you're going to start here and pull it this direction.
So first you can do is even stretch the kneecap a little bit, Brad. Just push on the edge of it like this. And the idea is sometimes that the kneecap is riding too far out to the side.
Right. There's a groove it's supposed to be in when it's working properly, and it's not in the groove.
Yeah, so we're pushing it more towards the middle. I don't know, I suppose we could show it on this knee too, but and then eventually I'm going to go ahead and pull the tape over and see if it helps. Now I know there's probably therapists out there that are screaming, that are purists about this, because there's this could be tilted, or this could be one way or the other. But honestly, a lot of times if you just take the tape and you put it on the edge of the kneecap, on the outer edge, and you push it over, Brad, and then pull it down and tape it, a lot of times it'll pull it over enough to see if it helps.
And you'll get some wrinkles in the skin. You're pulling that far. And I've done this with people where they have them go up and down stairs. This is a good test. Say your pain's at a 7 or an 8 going up and down the steps, tape it, and then go up and down the same steps. And they say, oh, wow, does that make a difference?
Yeah, and I usually double tape it, Brad, by the way. I'll usually do it again. I'll push it over again and then pull it down like that.
Yep.
And then, then you just go ahead and I go back up the steps. you know, and I step back up and I go, oh, you know what? It didn't hurt as much that time. You know, I'll go up 5, 6 steps. I don't.
Sure.
We don't have 5, 6 steps here. So this is always the part that's fun, isn't it, Brad? Owie.
Yeah, yeah.
So that's the second exercise or tip you can try. All right, the next one, Brad, is...
But Bob, there's people that haven't seen us before, I think.
yeah, hi. Welcome to our channel. By the way, if you haven't been to our channel before, we ask you that you please subscribe.
Right, and we're going to have videos like this every day, right, Bob?
Yeah, we upload every day videos on how to stay healthy, fit, pain-free. So
And
the
strong.
subscribe button is somewhere over here, depending on who you are, apparently. All right, the next one, Brad, is this is also quite often with arthritis, but it might be even with some people. If your knee is not fully extending, straightening,
You're right.
it's putting extra stress on your knee throughout the day. So,
Yeah, I'll show them from this view.
yeah, that'd be good, Brad. Yep.
I don't know if they want to see this leg, but so you go like this, and this is fully straight, but let's say it only goes about that far, and it's lacking about 10 degrees or so.
Yeah, one way to test, unless your both knees are bad, sometimes if you put both legs up there, you'll
Right.
see one is higher than the other.
Yeah.
And that's a sign to you that that one's not straightening out of the way. And
Sure.
it really behooves you, there's a word there, to actually get that to straighten all the way, because it
Right.
does spread the forces out in the joint. And
Yep.
I've seen people get relief from this, Brad. So there's 2 ways you can stretch it out. One is a sustained stretch, where you just let it stretch, you know, for...
Just let gravity.
Yeah, let
work
gravity do it. You can put a weight on there if you
Sure.
want. You can put something to give a little extra stretch.
Sure.
And the second one is what we call pressure on, pressure off. So you're going to go ahead and you can grab, you know, top and below like this, and you know, you can do it yourself.
Yeah, it's usually people are more relaxed if they do it to themselves.
Right.
So you're just going to push down, pressure on, and just like Bob was saying, just say pressure on, pressure off, pressure on. Usually about 10 times
Yep.
in a row, and then come back later on.
The first day I would only do it 1 set because I still remember this. I did it to somebody that, you know, the first time, and it was really working, and we did like 4 sets. He was so sore the next day. I mean, and then it ended up working, but he almost didn't want to come back to therapy because we got him so sore.
Yeah. So yeah, start gradually.
Yeah, and again, like you said, the pressure on tells you how long you're supposed to push.
Yeah.
Pressure on, pressure off. So that gives you the indicator of how long.
And typically by the 10th one, it goes down farther and it feels better overall. If it gets worse and worse and worse, just stop.
Now this may seem a little counterintuitive, Brad, because we just told you to get your knees straight, but when you're standing, I don't want your knees straight.
Sure.
Because if you stand, all right, Lonnie's going to love me. You want to stand, Brad?
Yeah, I want to stand.
Lonnie doesn't have to get up as high then. When you stand, don't lock your knees. You know, keep them slightly bent. What helps quite often is if you stagger your stance.
Yep.
So 1 foot in front of the other, just slightly, Brad. You know, so
Sure.
it looks a little normal.
Yep.
But if you stand all day, and like I had a worker that he worked at Subway, and he stood all day, and he would lock his knees, and they were stretching out further and further. All we did with him, Brad, is we had him stop that.
Sure.
Took away his pain. That's all we did.
Would you say usually these are people that kind of have hyperextended
Yes.
knees
Yeah.
naturally?
Yeah. And a lot of them become hyperextended. The reason I know it, Brad, because my knees do not hyperextend now, but they were getting hyperextended.
Oh.
I mean, just
Sure.
from doing this. And it
From
seemed like
bad
they almost
habit.
tightened up.
Yep.
So, all right. The next thing is what we call is a cross fiber for pain. This is for pain above or below the knee. So let's say you're getting pain right below here.
Yep.
The tendon there. You know, want to make sure that you don't have Osgood slaughter or anything like that if you're a younger kid. But if you have a patellar tendonitis, but you can also have a quadricep tendonitis, which is on top of the knee, where the muscles come in. I've had this, so I'm very familiar with it.
Yep. And so he's saying the knee, it means the kneecap.
Yeah.
So you look at the kneecap and the tendon right below it, or the tendon where it connects. And the tendon above is one of those really wide tendons. It's not like a bicep tendon.
Glad you clarified that, Brad, because I don't think people were clear on that. I mean, seriously, yeah, good,
Sure.
thanks. So on either side, what you can do is what we call cross fiber massage, cross fiber friction massage.
This is by far, I think, one of the best techniques that people can do at home and have success.
Right.
You know.
Yep,
If
they
it's
can do themselves.
Yep.
Yep.
Should we show them how to do it?
Sure. On the cross, you're going to take one finger, put it over on the top of the other, or 2 side by side, and you're just going to rub very deeply, a lot of pressure
Right,
going
aggressively.
across the tendon. And what you're looking for here, Brad, quite often is that the pain after a minute or two is going to start calming down.
Right.
If it just keeps getting worse and worse, then you maybe need to ice
Yeah,
for a while.
it needs more time to rest.
So you're going to go ahead and rub that, and you're going to go and, you can go up to like 4 or 5 minutes, and something like this you could do it daily, even 4 times a week maybe.
Yeah, your fingers will wear out before too long.
The same with this one. You can do the rubbing. The same thing you're looking for is that you're looking for things to calm down after a little bit.
And on the one above, you can actually use both fingers like this, and it's a broad area sometimes. It all depends on how it feels.
All right, next one, Brad, is eccentric strengthening with the ball. You want to give me the ball, Brad?
Yeah.
We're going to go to the wall here, Lonnie. I'm going to move this out of the way.
This is the ball on the wall.
That's
exercise.
right. So this is the one I used actually for my quadricep tendonitis.
Sure.
So I'm going down, and that's where the stress is on, Brad.
Yep.
And then on the way up, I would lean to the opposite side and put the pressure on to come up.
So this one's doing the work coming up.
Yep.
The involved one, the painful one, is
Doing the work on the way down. So it's eccentric. It's strengthening while the muscle is lengthening.
Right. Yep.
So then I lean over and come up like this. Now, if they're both that way, which I had both that way,
what'd you do?
there's not much you can do. I mean, I was just going and working it a little slower on the way down, and I'd come up a little faster.
One thing I think you could do is, put a cane on each
Yes, you
side.
could. And you could push up.
Or chairs so you can use your arms to assist.
Yep, that's a very good idea, Brad. I could push up like this and then work it on the way down.
Yep.
But I did these, and it took a while. It does take a while for this to give relief, but it does work.
This isn't one of those quick
All right.
2 or 3 day.
The last two, Brad, are, it's very good just to keep the knee moving almost with most problems. If you do bicycle or elliptical,
Sure.
it's going to be very good.
Yep.
And also isometric exercises are real good.
Sure.
Just laying down and...
Yeah. I was just... Do you have any that you particularly use?
I think just, you can do lots and lots of these. Just holding it up like
a
these.
simple one, just holding it. Yeah. I guess
And
the other
with
one,
weight.
I don't use a lot of these, and I probably should more in my practice. Put your heel down. You can put something like your fist under the knee, and if you don't have someone to put their fist under, so he's squishing my knee while his heel back here is staying close to or right on the table. You can get a ball, probably a little bit bigger one than this would work best, but that would work too.
Yep.
Squish.
Wool towel, anything like that. So,
Yep.
All right.
Wow.
Remember,
that's
Brad, we can fix just about anything.
except for that
Broken heart. But we're working on it. Thanks a lot.